Every single night, millions of people fall asleep in a position that doctors say may be quietly increasing their risk of stroke. It feels comfortable. It feels natural. You have probably slept this way your entire life without ever questioning it. But cardiologists are now warning that this one sleeping position may restrict blood flow to your brain for hours at a time, every single night, without you ever realizing it is happening. In the next few minutes, we are going to show you exactly what this position does inside your body, and the simple change that may help protect your heart and your brain while you sleep. If you are over 50, this is something you genuinely need to know. This position has a name. Doctors often refer to it as the curled side sleeping position with a bent or compressed neck. It is one of the most common ways people sleep, especially as they get older and seek comfort over alignment. But here is the problem. When your neck bends sharply to one side for hours during sleep, it can place direct pressure on the carotid arteries, the major blood vessels responsible for carrying oxygen-rich blood from your heart to your brain. For a healthy young person, this might cause nothing more than a stiff neck in the morning. But for adults over 50, especially those with existing blood pressure or cardiovascular concerns, cardiologists say this repeated nightly compression deserves real attention. To understand why this matters, you need to understand how your brain gets its blood supply. Your brain requires a constant, uninterrupted flow of oxygen-rich blood to function properly. Even small interruptions can cause noticeable effects. The carotid arteries on either side of your neck are responsible for delivering the majority of that blood. When one of these arteries is compressed, even partially for an extended period of time, the flow of oxygen to that side of the brain can be reduced. Cardiologists explain that while a single night of this position is unlikely to cause serious harm, the concern is repetition. Night after night, year after year, this repeated partial restriction may place additional strain on blood vessels that are already vulnerable, especially in adults with high blood pressure, atherosclerosis, or other cardiovascular risk factors. This concern becomes more significant with age, and there is a clear biological reason why. As we get older, our blood vessels naturally lose some of their flexibility, a process called arterial stiffening. Arteries that were once soft and elastic in our 20s and 30s gradually become firmer and less able to adapt to pressure changes. Combine this with conditions that become more common after 50, high blood pressure, high cholesterol, or early signs of atherosclerosis, where plaque builds up inside artery walls, and you have a situation where even mild, repeated compression from a sleeping position may have a more meaningful impact than it would in a younger, healthier person. This is exactly why cardiologists pay closer attention to sleep posture in patients over 50, particularly those with existing cardiovascular risk factors. Now let's address the question you are probably asking. Can a sleeping position actually contribute to stroke risk? Cardiologists are careful here, and so are we. There is no single sleeping position that directly causes a stroke on its own, but research suggests that significant, repeated restriction of blood flow to the brain, especially when combined with existing cardiovascular risk factors, may contribute to the broader conditions that increase stroke risk over time. This includes reduced oxygen delivery to brain tissue and added strain on already narrowed or stiffened arteries. Think of it less as a single dramatic cause and more as one additional factor, among many, that may quietly add to your overall risk profile over months and years of repeated exposure. So how do you know if your sleeping position might be affecting you? Cardiologists suggest paying attention to a few specific signs. Waking up with neck stiffness or pain that lasts well into the morning. Waking up with a headache, particularly on one side of your head. Feeling unusually groggy or mentally foggy in the morning, beyond normal sleep inertia. Occasional dizziness when first standing up after waking. None of these symptoms alone confirm a problem. They can have many causes. But if you notice these signs consistently, especially alongside your sleeping position, doctors say it is worth a conversation with your physician particularly if you also have high blood pressure, diabetes, or a family history of stroke or heart disease. Now here is the part that matters most. What can you actually do about this? Cardiologists generally recommend sleeping in a position that keeps your neck as close to a neutral, straight alignment as possible. This means avoiding sharply curling your neck downward or sideways for extended periods. Sleeping on your back with a supportive pillow that keeps your neck aligned with your spine is often considered one of the most heart and brain-friendly sleeping positions. If you are a committed side sleeper, doctors suggest using a pillow specifically designed to support the natural curve of your neck, rather than a flat or overly soft pillow that allows your neck to bend sharply. The goal is simple. Keep the pathway between your heart and your brain as open and unobstructed as possible throughout the night. Beyond sleeping position, cardiologists emphasize that this is really about overall cardiovascular health. Managing blood pressure through regular monitoring and medication if prescribed, staying physically active with regular movement, even simple daily walking, reducing excess salt and processed food intake, which directly affects blood pressure, avoiding smoking, which significantly damages artery walls over time, and attending regular checkups where your doctor can assess your carotid arteries and overall cardiovascular risk, particularly if you are over 50. Sleeping position is one small, manageable piece of a much larger picture, but it is a piece that is completely within your control, starting tonight. Here is what matters most from everything we have covered today. The way you sleep at night can place repeated pressure on the arteries that carry blood to your brain. For most healthy people, this is not an emergency. But for adults over 50, especially those with existing cardiovascular risk factors, cardiologists say it deserves real attention. Tonight, consider how you are positioning your neck. Aim for a neutral, supported alignment, whether you sleep on your back or your side. Pay attention to warning signs like persistent morning headaches or neck stiffness. And remember, sleeping position is just one piece of a much bigger picture that includes blood pressure, activity, and regular checkups. If this video helped you understand something new about protecting your heart and brain, subscribe to Anatomy Visual Lab. Every week, we explain what is happening inside your body, clearly, accurately, and without the confusion.